Good morning, good afternoon, good evening. Thanks so much for investing the time to let us tell you a little bit about what Freespira is, what we do, and how our evidence-based approach is helping patients all across America deal with the symptoms of PTSD and panic disorder. My name is Justin Sanders. I'm the Director of Client Success here. I've also got with me today Dr. Bob Cuyler. He's our Chief Clinical Officer. Today, we're going to share what it is that Freespira does to make an impact in patients' lives every single day. Dr. Bob, take it away.
Thank you, Justin. Happy to be with everybody today. So Freespira is an FDA-cleared prescription digital therapeutic that is indicated for the treatment of panic disorder, panic attack symptoms, and post-traumatic stress disorder. It's a use-at-home treatment that is provided in-home after authorization by a licensed healthcare provider. We'll be talking about clinical studies, but Freespira is backed by a number of peer-reviewed clinical studies with consistent positive outcomes. Freespira is a medication-free approach for treating these conditions. It is provided in a single 28-day treatment episode that involves twice daily practice. It has a very, very low side effect profile, and it is supported by personal health coaching that really helps a great deal in the high adherence and clinical benefit that we've been able to measure in the application of this treatment. Freespira is based on some fascinating science about the relationship between respiratory physiology and panic disorder and PTSD, which are really life-impairing conditions. I think most everybody realizes that in the course of a panic attack, a patient's breathing is significantly dysregulated. We recognize that hyperventilation is really kind of almost synonymous with what goes on during a panic attack. But what is not as widely known is that respiratory dysfunction or dysfunctional breathing is really characteristic not only during symptom surges in panic and PTSD, but is really common in daily life. The basis of this, when we look at the underlying science, is a concept that's called carbon dioxide hypersensitivity, that people who are at risk for these conditions engage in essentially respiratory coping strategies that backfire and actually make them more prone to have panic symptoms when they're exposed to triggering events. Freespira involves teaching people using respiratory feedback how to stabilize their breathing patterns to really help them manage their anxiety and symptom surges, not only teaching people how to normalize their respiratory physiology, but how to build life skills when they are in stressful situations that will help them cope and help them kind of nip in the bud when these symptom surges historically happen. We go to our next slide, please. Freespira is indicated for treatment of panic disorder. I'll also mention here it's indicated for treatment of panic attacks in association with other conditions. Common other conditions might be generalized anxiety disorder, separation anxiety disorder in young people, and other kinds of things. If you think about situational social anxiety disorder, being in stressful situations or performance that creates that kind of panic and freeze up when people are faced with stressful circumstances. We're also approved for treatment of post-traumatic stress disorder. I'll just mention here, sometimes we get the question, about 75% of people with PTSD have panic symptoms as part of that PTSD complex. And so that's really kind of the relationship between these two conditions and why the overlap in these conditions led us to extend treatment out to PTSD with good results. We are also available for individuals ages 13 and above. I talked a little bit about the patients that Freespira is indicated for. We only have relatively small contraindications. We are contraindicated for use during pregnancy. One is that we have not been studied for safety and benefit during pregnancy. And for FDA clearance, you have to have actual research with people during pregnancy. That's not been done. But also in the third trimester, respiratory physiology is changing in a way that would make this a treatment that would really not dial in well to the symptoms during the course of pregnancy. We're also not indicated for people who have late-stage COPD or other severe respiratory condition, particularly those for which carbon dioxide retention is a problem rather than overbreathing. We're also used with caution for people who have poorly controlled seizure or asthma. In circumstances like this, we would ask a personal physician to review and give a medical clearance for use, depending on the circumstances and comorbid conditions of this patient. We're also not a good fit for patients with really significant current psychiatric instability, such as those who are at current high risk for suicide or who have major disorders like schizophrenia or bipolar illness that are in periods of symptom exacerbation. Some of the differentiation for Freespira, one is it's a use-at-home intervention, which is really different from office-based psychotherapy. It's medication-free. We're also really differentiated from the thousands of other health and wellness apps that are available that may use psychological principles, but very few have actual published results, and even fewer yet have recognition by the FDA as a safe and effective treatment. Freespira is also notable for its short duration of treatment. It is confined to a 28-day course of treatment. As I'll mention in a few minutes about our clinical trials, we've been able to document a treatment benefit that extends out to a full year in published studies on panic disorder and 6 months with PTSD with only a single 28-day treatment. It's very easy to use, and I'll mention again, supported by health coaching available at the training stage as well as during the therapeutic month. So Freespira has several different important components. There's a hardware component. What you see on the right-hand side is the Freespira system that consists of a proprietary sensor that measures respiratory rate and exhaled CO2 levels. The patient breathes through the simple nasal cannula that you see in the foreground. Data that's captured by the respiratory sensor is sent via Bluetooth to a small tablet computer so that the patient is seeing breath-by-breath feedback of their breathing style. At the end of every completed session, this data is also ported to the company's secure server so that we have both individual and aggregated ways of measuring treatment adherence and treatment benefit. The task for the patient is really pretty simple. Their job is to breathe in sync with a rising and falling audio tone, i.e., we are helping people learn how to stabilize and slow their breathing. They also see a readout of their exhaled CO2 levels, and so it gives them the feedback necessary to adjust their respiratory volume to normalize this really important aspect of respiratory health. Its personalized treatment is supported by virtual training from a Freespira health coach with initial and weekly check-ins to facilitate engagement, answer questions, and support adherence. Next, I'm showing you examples of Freespira graphs from an actual patient from start to end of treatment. On the left-hand side, you see the graph during the 17-minute treatment period for each session. This is a patient with significant panic disorder. And if you see that extremely jagged green line, that represents somebody breathing in a very fast and unstable fashion, in all likelihood, breathing with their upper chest and not with their diaphragm. The blue band above is around the normal range of exhaled CO2 levels. And we see a patient with a persistently low exhaled CO2 levels, which is really considered to be kind of a signature for the respiratory dysregulation in these conditions. In the middle, you see the same patient 7 days later, and you see a really significant stabilization in that green zone of their respiratory style, no longer breathing in that very fast and uneven fashion. Up above their exhaled CO2 level is still remaining to be significantly below normal. On the far right, you see the same patient now 28 days later. We see a very, very smooth respiratory line. This patient is now breathing at 6 respirations per minute, which is less than half of the pacing that they were using during that initial session. So we now see a patient breathing in a very smooth and regular fashion. Up above, we see a remarkable stabilization of their exhaled CO2 level. So they have learned how to stabilize and normalize their breathing style. Even though this shows a very pretty graph in terms of its progression from this kind of chaotic breathing style to this very smooth breathing style, what's really important is to note that patients who will learn how to do this over a 28-day period have a very, very high chance of significant symptom reduction, if not remission of symptoms. Over 70% of patients who will use this during the therapeutic month will receive a significant and lasting clinical benefit.
So thank you for investing the time. Thank you for everything that you do to treat your patients. And most importantly, thank you for trusting us with your patients. My name's Justin Sanders. I've got Dr. Bob Cuyler with me. You can reach out to me at justin@freespira.com or feel free to give me a call at 904-566-5371. Thanks again and be well.